Hi guys, I'm Leah, and together with Sarah, we did our project on neurocognitive traumatic brain injuries. I am role B, so I'm going to skip down to my first slide, which is a summary of an article called The Impact of Traumatic Brain Injury on the Aging Brain. It was written by Young, Hobbs, and Bales. And in this article, they discuss some major issues that have come up more recently as there's been a rise in awareness of sports related injuries, especially concussions and mild brain injuries. More and more research is being done on this topic, as even young children who play hockey and football and other sports, even soccer, are starting to have issues with repetitive concussions as they get older. So it's not just an injury, a concussion one time. They have symptoms and then get better. It's we're seeing symptoms in people as they increase in age. There's been a link between traumatic brain injuries and neurodegenerative disorders like Alzheimer's, Parkinson's, and other psychiatric disorders. And one that's been a more recent issue is called chronic traumatic encephalopathy, or CTE. And that was recently coined by Dr. Bennett Amalu, which I'll talk about in a little bit. Prior research focused mainly on the immediate aftermath, as I just said, but now they're figuring out that there's major issues with these patients as time goes on. Some of these issues are behavioral and cognitive because they change in the brain as we age. Um, Also, patients who have had a concussion are now at a lower threshold for subsequent concussions. So the major issue here is repetitive concussions. With these repetitive concussions, there's electrophysiological processing of the brain is altered. Changes in the brain are seen years after the initial injury. Um, Football players with concussion injury tested with cognitive memory scales. They were significantly different than those without concussion history. There's also issues with military blast explosion impacts. This is a problem we're having with our soldiers who are going off to fight and have had head injuries. Also, there's a relationship between neurodegenerative disease and TBI, both mild and moderate to severe. So this isn't just mild concussions, although those are more common, but there are major issues with the moderate and severe types. NFL players that have died from a neurodegenerative disease are, well, they're dying at a rate more than 3 times the general U.S. population. So that's pretty big, alarming. Some of the risks of repetitive concussions, like I said, Alzheimer's, dementia, mild cognitive impairment. Um, and here I included an interesting quote: animal and human data support an abnormal accumulation of extracellular senile plaques and neurofibrillary tangles, the pathological hallmarks of Alzheimer's disease following TBI. So that was a really important discovery by the researchers. And then again, CTE, that's the more recent disorder. That's a progressive dementia found in athletes who have had repetitive concussions. Symptoms are irritability, aggression, depression, memory loss, and heightened suicide. And then we have Parkinson's, frontotemporal dementia, multiple sclerosis, and amyotrophic lateral sclerosis. That's better known as ALS, or Lou Gehrig's disease, and that's a progressive neurodegenerative disorder that affects upper and lower motor neurons. Um, and also, it's more common with traumatic brain injuries, especially in athletes who also have CTE. Um, Continuing with the article summary, traumatic brain injuries and other psychiatric diseases, there's a higher rate of depression. Um, One study showed those with a history of mild traumatic brain injuries were at a greater risk of depression, PTSD, panic disorder, social phobia, and agoraphobia. Depression following a TBI can be the result of emotional behavioral reaction or a direct result of the neurological effect of a TBI. So that's something that doctors and therapists, social workers would need to decipher whether the depression is coming from the actual injury or from the emotional effects of having the accident or injury. There's also a higher rate of anxiety disorders like PTSD and OCD. And, um, oh, okay. So that's it for my article summary. Moving on to some of the web resources I looked at. One is the Brain Injury Research Institute, and the one of the founders of this website and organization is Julian Bales, who actually co-authored the article I just talked about. He's a neurosurgeon, and he also is the one person out of many, well, out of few people that should. He supported Dr. Bennett Amalu in his research and discovery of CTE. And this was at a time that the NFL and other related organizations were trying to discount. They were trying to discount Bennett Amalu's research and basically throw it out the window. Um, and here I'm just explaining I've had a big interest in CTE since reading the book Concussion a few years back. That movie was, the book was turned into a movie, and it's all about the life of Dr. Bennett Amalu and how he coined the disease and the research he did in discovering it. And I just found it really interesting. But his research began with football players, specifically Mike Webster, when he began his decline, um, and was showing some pretty severe symptoms, not just Alzheimer's like symptoms, but severe aggression, and it was really, really sad decline. Um, and then he also researched the brains of other deceased football players as they began passing away. So that website has a lot of good information, great information on mild traumatic brain injuries, but especially CTE. And then, oops, hold on, let me see if I can move this up a little. And then my other website is the Alzheimer's Institute, and they provide a lot of great information on traumatic brain injuries and the symptoms, causes, treatment, and latest research on it. They discuss the linking of dementia pugilista, I think I said it right, sorry, which used to be called punch drunk syndrome in boxers. That was just their like kind of slang name for that disorder, but it was very similar to CTE. And they also provide information on other disorders like Alzheimer's and Parkinson's. So, and then my last website um, is the Injury Prevention Research Center of UNC. I live down here in North Carolina, so I was looking for more local information. And UNC being a great university, place of research, and hospital, I thought it would be appropriate to include one. in my area. So this organization is led by Jason Mihalik, and he is a neurotrauma researcher. And on his website, he provides facts on moderate to severe traumatic brain injuries in children. He also discusses post-injury rehabilitation, family involvement, and social and cultural factors in the research. So I just found it very informative. And we also have a big army base down here, so I know a lot of the local soldiers living locally go to UNC and even Duke for therapy and rehabilitation. So that is it for my portion, and we have all our references down here. Actually, I think we have another one to add, um, but that's it. And say it was really interesting doing the research on traumatic brain injuries and all the different disorders that can occur from even just mild repetitive concussions. So that's it. I hope you guys all enjoyed the course, and I look forward to seeing the other presentations. All right.